Welcome, everyone, to the inaugural I4 Insights, a podcast where we highlight amazing organizations who embody our I4 spirit of innovation, inspiration, invigoration, and ideation. Today, I'm thrilled to have Dr. Jennifer Zelmer, the inaugural president and CEO of Healthcare Excellence Canada. Formed in 2020 as the amalgamation of the Canadian Foundation for Healthcare Improvement and the Canadian Patient Safety Institute, she's been a C.D. Howe Research Fellow for several years, as well as an adjunct faculty member at the University of Victoria. She received her PhD and Master's in Economics from McMaster University. Welcome to I4 Insights, Jennifer. Thank you so much for joining me today.
Thanks, Josh. Great to be here.
I'd love for you. Just tell us a little bit about yourself. How did you end up as the president of HEC?
Well, originally, actually, I grew up in Edmonton. So then went to university in Victoria. And then when I was doing work terms, one of my work terms was at Alberta Health. I promise this story is going somewhere. And my boss at the time then moved to a national organization. So several years later, when I was coming back to the country looking for a new place to landed at the Canadian Institute for Health Information, which is a sort of sister organization to Healthcare Excellence Canada. And so I've had a chance to work at a bunch of different places since, but then really, when the opportunity came up to jump into this world, put up my hand and said, please pick me. And so landed first at the Canadian Foundation for Healthcare Improvement and then amalgamated, as you said in your intro, and we're now Healthcare Excellence Canada.
That's amazing. Sounds like quite the journey. I'm curious, Healthcare Excellence Canada, what's your mission? What is the work that you do?
Yeah, fundamentally, we're looking to shape a future where everybody in Canada has safe and high quality healthcare. And that's fundamentally about working with people right across the country, coast to coast to coast, to get better at getting better, build those muscles in the health system that help us to do things better. And then to take those shining points of light that exist everywhere, right? Those innovations, those interesting opportunities that start to show their worth and are proven, and spread and scale them across the country.
That's amazing. It sounds like your work sort of touches all the way from coast to coast. I'd be curious, what are some of the things that you're seeing right now? What are some of the challenges that are sort of experienced across all of these different systems when it comes to healthcare?
Yeah, it's so interesting because everybody, of course, has their unique aspects, right? Care in Spruce Grove is different than care in downtown Toronto or in Nunavut. But at the same time, everybody is facing challenges in terms of health human resources. So ensuring that we support the people who care, that we've got the right numbers of people to care. Everybody's facing challenges in terms of how do we really provide the best access to care, the safety and the quality of care that everybody wants and deserves.
That's amazing. I'm curious, from the health human resources piece, what are you sort of finding right now? Like, what is the lived experience of all of these individuals who are doing such a hard job, but an important piece of work?
You know what? I find that everybody I talk to who works in healthcare came in with big hearts. They came in because they care and they want to be able to care with and for others. And sometimes that's hard. It's hard. I mean, obviously it was hard during the pandemic, but it wasn't a walk in the park always before that either. And so we've got to be looking not just at how many people are we recruiting into healthcare, but also how are we supporting, retaining, and ensuring the wellness of the people who care right throughout the system.
So I as somebody who's worked in the healthcare system for quite a long time, I'm curious, like, what does that look like from Healthcare Excellence Canada's perspective? Like, what does supporting individuals at the front line look like? Or maybe what is the recommendations or the pieces of work that you've been doing around this?
So we have looked at what are some of those keys to retaining folks and supporting them to live their best professional lives in the health sector and do the things that they came into healthcare to be able to do. And there's not one magic answer, right? If it was easy, it would be done already. So it's always a combination of things. But we do know that one of the things that matters and is highly associated with retention is feeling like you can make changes in your workplace. Make changes that make life better for you, for your patients, for the health system. And so that's really at the core of the kinds of work that we do, because we're working with more than 1,000 frontline teams across the country who've said, I'm committed. I'm in. I want to make this care better. And that's one of the most both precious parts of my job, because I get to work with the people who just want to fix the world. But also we know that that actually supports retention as well. So it can be that big picture of, you're part of making change happen, and that's important for retention. It can also be very specific interventions. So for instance, we worked with TREC, Translating Research in Elder Care, which is based out of Alberta. And they designed a coherent breathing intervention and program for people working in long-term care, 2 to 10 minutes a day. So it's not a big, complicated intervention, but they found with the implementation of that intervention that it actually improved well-being. It improved sleep for healthcare providers. It improved ability to self-care. So all of those possibilities, from the very concrete, like that particular intervention, all the way through to how do we make sure that everybody in the health sector has a chance to not just provide the care, but also do the second part of their job, which is improving the way that we provide care on an ongoing basis.
That sort of piece of work, it just really reminds me how important it is that we make sure we still find ways to care for ourselves, because I think it's important to acknowledge healthcare is hard. It's a hard place to be. And I think, you mentioned COVID, and it sounds like your organization was formed like right at the start of that. So I couldn't only imagine the amount of stress and the work that you sort of took on during that period. So sorry to shift gears on you a little bit. I'm curious, like, what was some of the work that you were doing that time?
I mean, I wouldn't necessarily recommend amalgamating in the middle of a pandemic. It definitely added a layer of complexity to the process. But one of the big things we took on is pre-pandemic, we'd been working with people in long-term care. So we heard from them in that first wave, folks who were affected directly by the pandemic and the challenges that they were facing, and folks who hadn't been yet, but were really concerned to make sure that they were getting prepared in case they were. And it started small. So we started with talking with folks who'd been affected, with public health folks, with patients and families, with residents and families, and said, what's working for the places that are responding, and where are people getting into the soup? And from that, we identified 6 promising practices that we validated with a broader group. We started with 40 long-term care and retirement homes in the summer of 2020 and said, okay, let's do a self-assessment against these 6 promising practices. You identify in a super quick way, what do you want to focus on? Where can you fill the gaps? And then we'll provide a little bit of seed funding, some coaching, some expert advice, and peer-to-peer support to make it happen. So we started with those 40 homes. We ended up with more than 1,500 homes across the country doing this work. And the thing that I just find amazing, that was a really hard time in long-term care. We need to be aware of that and honest about that. And more than 2/3 of the homes who participated in that program said that they'd been able to make the quadruple aim changes. So changes in resident experience, in provider experience, in the efficiency of care, in value. And 1/3 of homes said they'd been able to hit all 4. Now that's, in that circumstance, that's truly amazing for the kind of impact that they were able to make. And then it's snowballed since in terms of what we learned from those homes and the changes they made, and be able to bring those to others as well.
That's so awesome. This work sounds really collaborative, and that's what I'm so interested in. So you pull all of these people together and these partners. I'm curious, what were some of your key insights when you were working with these sort of different organizations and long-term care centers?
Yeah, you're absolutely right. We don't do anything on our own, right? Everything involves folks who are working in the health system and folks who are receiving care. So patients, families, communities as well, bringing everybody to the table, because this truly has to be nothing about us without us. We know that that's one of the keys for high-performing health systems, as is involving folks with frontline capacity and capability for change, making sure you've got the right leadership conditions in place, looking to see, are there structural or policy barriers that are making it hard? And can you get rid of those, or can you adapt those so that nobody feels like they're pushing water uphill, but the right thing to do becomes easier? And having those other conditions for change in place too. And when we can line those up, and it doesn't always have to be, all of those perfectly lining up at the same time, right? It's where can you nudge forward and then nudge forward again, and then find out from your friend down the street, oh, we did it this way, maybe we can do that too. And start to build that momentum for moving towards excellence in care.
I love that. And that finding the momentum is like to say it's like those small shifts, right? And those small shifts, the more and more that we do them, those small shifts eventually turn into a medium sized and then eventually a large one. And I think one thing people often sort of forget is that when you even make a small shift, you have to recognize we're massive organizations. A small shift for, with AHS, 120,000 people, even if you're affecting 1,000, that's a large amount of people. That allows it to sort of spread, right? We always talk about that scale and spread. You mentioned a piece around leadership and something that they can sort of do in the sort of the leadership readiness. What does that look like from your sort of perspective? How do leaders best support staff and individuals at a frontline space when they're dealing with so much change and burnout and all of these things?
Super important. And we've actually just updated a set of leadership competencies because, our understanding of what's important in leadership evolves. The needs for different leadership styles and approaches evolves too, as the needs in the system evolve. And so, I think one of the things it starts with what are the opportunities for building engagement capable environments? So environments that really do have that together as the solution going forward. And that's absolutely with patients and families, with frontline staff, with partners in the community as well. Because how often do we talk in healthcare about the silos that we've sometimes created between either one organization and another, or even, who knows, one unit and another, right? So how can we create those engagement capable environments? How can we build the competencies and capacity for change too? I don't know about you, I did a lot of schooling. I wasn't taught about change really in that schooling. So how do we make sure that those things that we now know about implementation science and behavioral science, that those competencies are part of our toolkit as leaders? And that we've got, the connections, the relationships, the capacities, and to circle back to something we were talking about before, that we're also putting our own oxygen mask on first and making sure that we're in a good place to be leading at the same time.
Yeah, I love that. It's like we got to find ways to take care of our people and our leaders. And I really appreciate that sentiment around like engagement. How do we sort of engage them? But I think one of the things we're running into is sort of engagement overload or almost engagement burnout. And I'd be curious from your perspective, what does it look like to have good engagement? And how do we sort of remove sort of that possibility of people burning out from it or becoming cynical of it, right? It's something I'm seeing more and more often where people are like, I'm being asked the question, but I'm giving an answer and I don't know where it goes.
Yeah, so important. And, this is not formal research. I'll go back to something that my mother taught me a long time ago. Never ask a question if you're not ready to do something about the answer. But
Mm.
there's actually good science behind that, right? We now know that too. So that was something she told me like as a kid, but it proves out to exactly your point, engagement that doesn't have a clear path. It's not that always what you say will happen, but that what's happened to what you've said, how that fed into decision making, and then what the outcomes were. So there is that closed loop and a shared understanding. One of the things I find really helpful is there's also an understanding of a spectrum of engagement, everywhere from informing through to leading. And we're setting expectations up front. Where are we at on that spectrum of engagement? What can you come into this process knowing about? And are you prepared to come into this process on that basis as well?
That's awesome. I'm curious from an HEC perspective, how does that engagement look like? Because you're engaging, like you said, thousands of people across the entire country, and you go and you learn and gather insights and stuff. And I can imagine you come back and you synthesize. But what is that? What is the sort of the feedback loop look like from a national organization?
Yeah, so some of it is immediate feedback loop to the teams we're working with, right? It can be while we're together at an event, for example, here's what's going to happen. It can be a more formal, longer term process as well. So for instance, we use a policy lab process sometimes when there are thorny issues that you need to unpack. So for instance, you'll remember at the beginning of the pandemic that lots of doors slammed shut to families and other essential care partners. And there was a good reason that those decisions were made, but that also carried risk. And so one of the first policy labs that we did was saying, how can we support safe reentry of family and essential care partners? as part of the process. And so we had to get all the right people around the table and not just have that initial conversation, but feedback what we thought we heard to check out, and then go to a broader group to say, is this relevant in your context more broadly? And then we supported folks to say, okay, so let's start to implement this. And we had a whole series of peer-to-peer learning opportunities so that it wasn't just, here are the words on the page in terms of what came out of the policy lab, but also how does it apply in your context and how might it apply differently in mine? What are the core elements that you need fidelity to be successful? And where do you absolutely need to adapt to local circumstances to get the results you're looking for? And that's one of those key kinds of dimensions. And yes, absolutely including sort of formal report back mechanisms, but also including the opportunities for continued learning as well. So that the homes, for instance, that I mentioned that we worked with during the pandemic in long-term care, now we're having the opportunity, we're just launching it in a couple of weeks, to continue working with them on a more specific area. So person-centered care that decreases the inappropriate use of antipsychotics. So how can we continue to build on that learning that feeds in what we've learned before and then takes it to the next step too?
Oh, I love that. And I love this idea of sort of iterative change, this idea of like, we're going to learn something, we think we heard this, and then you validate it. I think it's one of the really interesting ways of sort of creating something is you make something really quickly and then you bounce it back to those who are it's going to be affected by the most. And they get to say to you, like, yes, this is great, or no, maybe you missed this sort of piece of context. And I think also it's really amazing to see the work that you do, you create it, but also it becomes flexible enough to meet local needs. What is it going to be needed for a specific facility, like you said, in Sherwood Park versus a place in Toronto, and how they can best utilize that information. I am curious though, you mentioned the use of antipsychotics, and that's a piece you're kind of working on now. Is there any work coming up in the future that you're really excited about?
Well, that is actually one that I am excited about, partly because it's an area we actually were working on with a number of groups pre-pandemic. And during the pandemic, well, we went backwards. And it's understandable why some of those gains were eroded during the pandemic. But the good news here is we actually have experience that we know that this is something that we can move. So, okay, let's move it again. And then let's figure out how this time it can be stickier than it was last time, even through difficult circumstances, because who knows what those circumstances are going to be in the future, but there are going to be twists and winds in the road. So how do we do that going forward? We're also looking at a whole series. We just started the next cohort of our leadership fellowship. And so I had the opportunity last week to spend time with the fellows. They're doing such interesting work. So for instance, one of the teams is in northern Quebec, and they're doing medical evacuation to the south. And they're looking at how do they make sure that through that medical evacuation process, that the patients and the care providers can communicate with each other well, because they don't always speak the same language right now. How do you make sure that you can have safe transitions in care that respond to the needs of those communities, that respond to the unique circumstances of being in a plane in the middle of nowhere, right? How do you support different types of care processes along the way? So lots going on.
That sounds like really amazing work, especially with all of the things that we've been seeing in Alberta too, where there's really quick moments where we have to transition a lot of people from one space to another that can feel highly chaotic. There's a lot of information that's being thrown around, and there's multiple handovers, right? So how do we make sure it's as safe as possible? That sounds like really amazing work. And I'm curious if people who are listening in would like to learn more, where can they go?
So our website is always good for support a call, healthcareexcellence.ca, and there's tons of information there about resources that have come out of our work in long-term care, our work around supporting a healthy workforce, the leadership fellowship that I just mentioned to you, and also free educational opportunities. So around, you want the essentials of patient safety, we got you covered. Do you have a board who you want to bring up to speed because maybe they're not from healthcare and you want to make sure that they have foundations in quality and safety? We got covered for that too. So the website's a great place. We're also on socials, including we've had a really high increase of folks participating on LinkedIn as well. So you can get some sort of immediate tidbits there as well.
Oh, amazing, Jennifer. Thank you for sharing those resources. And we'll make sure that there's a link down below that people can access to get to their website and find all of those different pieces around education and reports and stuff as well. Jennifer, is there a final message or something that you would leave with our I4 participants as we close out our episode this afternoon?
I think anybody who's chosen to participate in I4 cares about innovation, cares about making things better. So it's probably kind of opening the curtain to say we're actually recording this right before Thanksgiving. So a big thank you, because change doesn't happen on its own. It's not always easy, but it starts with that commitment to make things better. So thank you to everybody who's listening, who's participating, and who's taking that next step.
Amazing. Thank you, Jennifer, so much. This has been a great conversation. Super insightful for me as I throw in one of those I4s. I know I'm very punny. I just want to say a huge thank you to yourself and HEC, Healthcare Excellence Canada, for being a part of I4 and a partner. To all of our listeners, thank you for taking the time today. My name is Josh, and this was I4 Insights.